I'm Niall Dickson. I'm the Chief Executive of the NHS Confederation, and I was the BBC's Social Affairs Editor.
And you were my boss then?
And I was your boss. I can remember having a security guard at night while reporting, and there were groups of people all sort of crowding round because the level of interest in that case, obviously at local level, was very strong.
I was Niall's producer when we covered the Harold Shipman inquiry. It was a shocking story in every sense. Shocking to the families whose relatives he had killed, shocking to the community he'd been part of for years, and shocking to the country. A doctor, a provider of care, a figure of trust, was proven publicly to be murderous, calculating, and the medical system revealed itself to be full of holes.
The fact that he was a psychopath, most patients could probably differentiate between the average doctor and a mass murderer. But the question was, how did he manage to kill so many people?
I asked our social affairs editor, Niall Dickson, how the murders could have been allowed to happen.
Well, I think the case shows how little supervision there was of family doctors by the health service over all these years. The health authority didn't know that he had a criminal conviction. The health authority didn't know that his death rates among elderly women were very high. They didn't even know that 5 elderly women had actually died in his surgery in a period of 4 years. Now, people don't actually die in doctors' surgeries. It's highly unusual, but they didn't know that. Not necessarily because this health authority was incompetent or useless or anything like that. It's just that the systems for health authorities around the country are not there to supervise family doctors, and I think this will now raise very serious.
I remember we went to Hyde and we went filming outside where his surgery had been, on a normal high street in a perfectly normal part of the country, and just trying to imagine what had gone on there.
The people of Hyde had considered Shipman to be not just a GP among their midst, but actually someone who they admired and liked and were very fond of. And I think it was that sense of betrayal which you could detect from talking to people, certainly obviously those who had been his patients and who had trusted him, and a realization among many of them that they'd got away with it, as it were, because unlike so many others, he hadn't actually killed them.
There'd been disbelief. People were unwilling to admit what had happened. They didn't want to give up their trust easily in that pillar of the community. If a doctor was revealed to be a dangerous fraud, what other horrors, what dangers might lurk?
Certainly in the initial phases of when he was charged and all the rest of it, there were quite a lot of people who were very much backing him and saying that this was obvious nonsense. And I think that just illustrates the strength of trust that can exist, and in many ways it's a positive thing, trust that can exist between professionals and patients or clients.
I remember so clearly trying to find ways of conveying the horror in our TV reports without creating panic, without sensationalising. But we knew the story mattered and had shaken people's faith.
Addicted to killing, Britain's worst serial killer murdered 215 of his patients. The victims' families are told Harold Shipman caused unimaginable distress.
And remember, at the beginning, I don't think anybody had any notion of the number of murders that he'd carried out. That only emerged in the inquiry itself.